Hi everybody, welcome to this co-video. This is Dr. Kestler from Lorain County Community College. Today's going to be a little different. And what I plan on doing a little bit differently today is I'm not going to put up any graphs. I'm not going to talk about testing. I'm not going to talk about cases and all kinds of stuff. Instead, I'm going to give a little bit of talk about two things here today. One of them is words, and words matter. Names matter. How you name things matter, and I'll get into a little bit of that. And the second thing I'm going to be talking about is culture and epidemics, culture and pandemics. That's a better way of putting it. There's a lot of things that have to do with culture and pandemics, and we'll see what happens with culture, the culture of the COVID pandemic, what that turns out to be. All right, let me start with my temperature, and it is 97.2, and it's 36 degrees centigrade. So I want to start out with words. What's in a name? And we have a bizarre way of naming viruses in microbiology. We name them by people. We name them by disease. You know, my tagline at the end is "We persist like a lentivirus." Lent means is a Latin word, means long period of time between Ash Wednesday and Easter where you can't eat chocolate. So a lentivirus establishes a long persistent infection. That's kind of the name there. We name them after their species. We name them after a disease. We're going to talk about influenza today. Influenza is an Italian word. It means under the influence. That's literally what it means, under the influence of the disease. The full expression is influenza di freddo. And influenza di freddo means under the influence of the cold. So we have all kinds of names. We name chicken pox, symptoms. Pox is a mark that's formed on you. Herpes means it's a wet kind of weeping wound. We have all kinds of different names that we have. What does it matter? Well, I'll tell you, the last one I didn't mention, you'll see on this little word map here, there's a lot of words that have to do with physical locations. And it's probably the worst way of naming a virus because viruses rarely respect borders. Viruses like to get up and move. That's kind of what they do. It started out we talk about West Nile virus. West Nile virus can be found in Ohio. So why call it West Nile virus? St. Louis encephalitis is not just found in St. Louis. So the virus that we were talking about now is named COVID, which is kind of a very sterile name. It is initiated someplace else. We're going to be talking about the 1918 flu, which some people called Spanish. In fact, if you want to know where it originated, the Spanish flu, the 1918 flu, originated in China. But it really doesn't matter because that's not very helpful. The fact is the Wuhan flu, and to be real crude about it, some people call it Wuhan, the Wuhan virus, the Wuhan flu. That one is called COVID now, and it is really not Chinese at all. That virus is not from China. It's now mostly an American disease, and I think I'm not going to even go into the numbers or anything, but it certainly is an American disease. So all of these names are kind of silly. Sometimes we get names wrong. We actually, let me show you one of the first papers that I wrote, and that is about HIV. HIV started out, by the way, being called all kinds of things. At one point, it was called GRID for gay-related immunodeficiency disease. It also has been called gay cancer because there are some cancers that are opportunistic infections with it. A whole bunch of different names, and one that you can see in the bottom of this abstract that I wrote, there is a reference to HTLV, HTLV3, HTLV4. Both of those names are obsolete because HIV is not a leukemia virus. Human T-cell leukemia virus type 3, really? Nope, it's not that at all. So we actually renamed it. So you'll see that reference no more. And the reason is because it was wrong. Why did we think it was a leukemia virus? Were we that stupid that we thought an immunodeficiency virus was the same as a leukemia virus? No, not exactly. The reason that we did that is because there was some similarity. By the way, leukemia and AIDS have some similar features in terms of symptoms. There's also some similarity in one of the proteins that exists, this thing called GAG, which is part of the capsid of the protein. All right, for the rest of the time, I'd like to just talk a little bit about culture and the culture of epidemics. And I got to tell you, when this first started, I got approached by one of my students, and this was a student who was I remembered very well, and she was very concerned about what she should say to her child. What should she say to her kid, to her son? How should she explain this whole pandemic thing? And I got to tell you, I got nothing. I had no explanation. I didn't have an explanation, but I will tell you, we almost always find a way to do these things. We almost always find a way to speak to generations. And the most famous one is the Black Plague, which is, from previous COVID videos that this is the biggest plague of all, the Black Plague. And there is something that still persists to this day about the Black Plague, and it has to do with this. Some of you may have heard this, ring around the rosy, a pocket full of posies, ashes, ashes, we all fall down. Turns out that poem is very dark. And if you look at the meaning of it, it's based on some illogical things, and it's also based on a way of sending an oral history to a next generation. That's kind of what this is about. And so ring around the rosy refers to a rash that you would get around a pinpoint bite that a flea would bite you, and that flea carried Yersinia pestis, and then you would develop a rash around that. So that's the ring around the rosy. Pocket full of posies. On this next slide here, you'll see this guy with the fancy bird beak mask. There's a lot of discussion going on right now about masks and how good they are and what they do. This mask was not an N95, I can tell you right now, but it did provide him some protection because it gave him distance from, or her. I can't tell what gender that doctor is. That's a physician, by the way. And in his or her pockets, there are some flower petals, because this guy was what we call a miasmith. And a miasmith is somebody who believed that smells are responsible for disease. And they, in fact, are not responsible for disease. And so what he would do is he would sprinkle flower petals on people. Now, we're in the middle of trying to figure out an awful lot. People are asking me about this drug and that drug, about malaria drugs, about high blood pressure drugs. I'll get into that later. We're still working on that. We're still trying to figure all that out. But at any rate, the flower petals, did they work? Well, I can tell you this, those flower petals worked no better than placebo, and placebo is a real thing. And that is something I'll bring up later on, I guess. So at any rate, he would not only was he a practitioner, he was not selling snake oil because he truly believed that the flower petals were protective, because inside that beak he had flower petals in there. The next line is, so that's the pocket full of posies. Ashes, ashes is very dark. It's all about cremation. And we all fall down is about the inevitability of this all. This is an oral history that I believe was passed on from parent to child to teach them about something bad happened, and you need to know about this. And then I would imagine a parent teaching their child this for the first time and realizing what the best approach was. What is the best approach for communicating that message? And then they realized that, oh my gosh, that was a dark message from my parents. So that is, I guess that's one way of getting about it. Let me talk about influenza. Influenza also has a culture associated with it. This little poem was taught by little kids, little girls skipping rope, singing, "I had a bird, his name was Enza. I opened the window in influenza." That actually has a little bit of a message to it. Keep the windows closed because um, people are worried about cold. Remember, influenza, under the influence of the cold. Influenza, the 1918 flu epidemic also played a role in some other kinds of things. I want to tell you about the parlor. Once upon a time, we called the front room, we called it the parlor or the receiving room, and it was a very fancy. By the way, parlor comes from French. Parlez-vous français refers to, do you speak? So it's the speaking room. It's where you sit and talk with people. I'm actually in my parlor right now. The receiving room, it got called. And then in 1918, it kind of changed its purpose. In 1918, it became a place where bodies would come, where funerals would take place. You brought the body into the parlor before we got modern parlors, funeral parlors. They came into the home and they sat in the house, and the family received guests. And then a few years later, the Ladies' Home Journal came out with an idea. Since the parlor was becoming the death room, they wanted to reintroduce it. Once the epidemic was over, what is this going to become? Let's call it the living room. The living room is a concept that has persisted, and some of the cancer patient rooms are called living rooms. HIV, we called it, we would call, for HIV patients, we would call it the living room, where you would go to live, not go to die. And that was actually a campaign started by Ladies' Home Journal. All right, that takes us to HIV, the culture of HIV. One of the things that happened early on in HIV was the first thing. Randy Schultz wrote this book. I mentioned this in a previous co-video called "And the Band Played On." And that is, some people just kept on behaving like there was nothing going on. Just like on the Titanic, the band played on as the ship was going down. By the way, in our country, some governors are opting to do that band played on. We are going to just continue business as normal. Fortunately, we live in a state where we have a governor who is taking action. He's getting out the lifeboats. He's looking for the life preservers. He is somebody who is proactive, and I can tell you it is definitely working. Another piece of culture, there is an episode from South Park called Tonsil Troubles, and it's actually, I consider it a documentary about urban legends, urban myths. Perhaps the greatest thing that came out, the greatest accomplishment, or not the greatest accomplishment, one of the things that came out of the HIV epidemic was the AIDS quilt. And it was a massive community art project. And if you've ever seen it, I saw it the last time it was together in one piece. It was here in Washington, but the year before I saw it in Montreal, and it was quite impressive. It is impossible to have the AIDS quilt in one place anymore because it's just too massive, and it was it was very, very moving tribute to people who have passed away, and it's very emotional if you've ever seen it, and it is something you should really check out. One of the other things that happened as a result of the HIV, I think we all learned to be more tolerant of each other and more accepting of each other, and that is just a wonderful thing, because I got to tell you, people are all different, and that is biologically a wonderful thing. Now the question is what is going to be the culture of our epidemic? What are we going to take away from this current epidemic? I don't know. I don't know how we will explain it to children. Maybe we'll just sing them some sort of a Ring Around the Rosie poem. Or maybe we will do what this family did. I posted this on my Facebook, and it is quite spectacular. If you get a chance to see it, it is a beautiful thing where this family who is hunkering down together does a song from Les Miserables. It is just a wonderful, wonderful piece of culture, and I'm sure the culture of the COVID epidemic will produce some other great things as well. Well, I'm going to leave you with that, and I want to just say something to you all that I hope you are all good to each other, and I hope you all may persist like a lentivirus. And if you get a chance, enjoy that video. Thank you for tuning in to the MicroProf Learning Network.